Welcome to Suzanne's studio. I'm Suzanne Barnett, your host. And tonight, I always say this, but we have such a special guest, Dr. Stanley Fischman. Dr. Fischman, this is, I think, your fourth appearance on the show over the years. And the reason being is because you're so exciting. You give such wonderful information.
Thank you.
And you're a psychiatrist who has practiced for 58 years.
That's correct.
And you practice in El Camino Hospital in Mountain View. So we're going to start again. And Stan, I just really appreciate, I have to tell you, I really appreciate you being here.
I'm honored to be here.
Thank you. But after 58 years, you're not burned out at all.
I hope not.
Why not?
Well, why not? It's very exciting because so many new things are happening and so many new ideas are coming along. And it's very, very good just to be part of the growth and change that's occurring.
And you specialize in child and adolescent psychiatry.
That is correct.
But you also, you would also treat an adult, wouldn't you?
I do treat adults, yes.
Yeah. But your specialty is in this other area,
correct.
Child and adolescent.
Mm-hmm.
Why do you like it so much?
Well, it's fun to get up in the morning and know that you're trying to do something to help somebody who is feeling, having a difficult time or has a difficult disorder, and to see if there are new ways that we could try to help that person because everything else has failed.
Well, you know, I think everybody would like to know when a person is anorexic, a child or an adult, can you really treat them and make it work?
Absolutely. They can be helped, and the key is for them to really feel that there's somebody on their side. We live in a generation or a time when being skinny is very, very important, and being thin is something that gets you into trouble. And unfortunately, the nature of how the body responds to dieting sends off signals to the person that that make them afraid of becoming fat and losing control. So they starve harder, and it just becomes a very vicious cycle. So, but the key is to help them understand that. And I don't think it's necessarily purely a psychiatric disorder, as some people believe. I think it's a disorder that involves the body once starvation takes place. And I say that because the body, we're here today, all of us who are watching TV and everybody in the world is here today because we have survived long enough to have children. This takes us back probably a few million years. And the biggest killer throughout history, besides wars probably, but they were often brought about because people were afraid of not getting enough food. The famous theories along that line. What happens is that people, when they don't eat, their body gets panicky because famine was the biggest killer besides wars. And when just look at the Bible, for example, that's all they talk about. Everything happens because of famine. People move from one place to another. They trail all over the place. They'll even go through deserts at a great length of time, just effort too, just to find themselves food and a secure source of food, like the Nile River, for example, if you read the Old Testament. Fascinating. And so our bodies all these years wanted to be on the fatter side, if you will. So we always have, it's like money in the bank. And so the body signals you when you're starving and doesn't know you're doing it on purpose these days. It signals you to go get food. Most of us have experienced that when we've missed a few meals because we were very busy. Got to get some food. And so that's a very important thing to do. And yet most of the signals it sends us scare us.
Indeed.
Into dieting more.
Yeah.
And we live, and our body actually makes us look bigger to ourselves when we're dieting. Isn't that amazing?
Yeah, it is.
And it does that, I think, this is just a guess, I think it does that to give us the strength to go on so we don't give up till we hopefully get some food.
Yeah, yeah. Well, I think tonight we were talking about what is really pertinent right now. And I think that the brain injuries, the sports people, how would you address that, Stan?
Well, I think that we're learning a tremendous amount. First, we're learning that different ages have different incidents of that. Different sports have different incidents of that. Different relationships between couples play a much greater role at different ages and at different situations. For example, teenagers have a very high rate of this because of the kinds of games we play. And I have one patient who, at the age of 15, was badly injured by just lost control of a skateboard and ran into an object on the street in which he sustained a lot of trauma. We find also that the more traumatic head injuries we have, the more likely it is to have more head injuries, for obvious reasons. The person being uncomfortable and not having the judgment that he might ordinarily have, might be taking risks, or just because they're involved in sports. And it's been, we know that the NFL for many years was experiencing this. People were showing some symptoms, which I'll describe a little bit later, that allowed them to keep on playing football. And the NFL covered over a lot of this, except there was a whole bunch of people who eventually committed suicide or did something along that kind of line, even though they had been great and healthy when they were playing football itself. So there are just many, many causes. Children, infants, often have it if they're shaken a lot.
And what about, when they have parents throw them up in the air?
They may or may not have it from that. But when you're angry at a child and you shake it very heavily or very actively, you can actually cause brain trauma as the brain is bouncing back and forth against the skull, which is very interesting if you just think about it. We don't think of it that way. And if somebody is a little too excited about the whole thing, whether because they're angry or whether they're because they are just having a lot of fun playing with the child, they think it's cute. And that's not necessarily healthy.
May I just ask you a question?
Sure.
I mean, it's such a general question, Stan, but are some of these injuries totally irreversible?
Well, that's one of the most interesting things. A certain percentage of people, it's reversible, and certain people, depends on the intensity of the trauma. So we don't recognize how much damage we do to the brain that doesn't show up for a long time. They might look great today, but 6 months from now, 6 years from now, whatever, they may have tremendous changes in their brains. In fact, many people end up, as a result of the injury, having classical psychiatric symptoms of things like bipolar disorder, brain damage, of course, and even though it didn't show up very much at the start, it's a progressive process, because once the nerves are injured enough, they can't reproduce, they get tangled with each other, and they don't function like they normally do. And some people have all the symptoms of schizophrenia. And treatment of these is kind of difficult, but it's on the way down in their lives. And eventually they may want to commit suicide, they may just have chronic headache, but there are all kinds of symptoms they can have that really mimic other disorders.
You as a psychiatrist, how could you give an example of how you would treat treat that? Just
Well, it's very difficult.
Yeah,
It's never going to be perfect.
It isn't?
As of now.
Yeah, okay.
I shouldn't say never, but as of now,
yeah.
I can't say it's perfect. But sometimes it's just treating some of the symptoms, let's say, of schizophrenia.
Yeah.
And just treating that, and that helps the patient. It doesn't cure the problem, but it helps the patient. And so they don't lose control as easily. They're not as impulsive and explosive as they might have been if we treat their symptoms correctly. And it seems like we're learning to once that we understand the cause of it, not to get too hung up in it, doing any more surgery or anything like that, because that doesn't help, but just treat the symptoms for as long as we can without the patients breaking through.
I would think that would go along. You'd absolutely have to have psychiatric treatment.
I would think so.
Yeah.
I would think so, because most neurologists would throw up their hands and say, I don't know how to manage this, go see a psychiatrist or go see, you know, some other person who may be a specialist in that area.
Have you had that experience yourself?
I've had a number of patients.
And with the children?
Oh, with the children?
And the adults?
Yeah. Well, sometimes it's hard to get people to tell you that they shook their child too hard.
Yeah.
Because they may not see that happening. They may not see the changes occurring in the child at that point. Child abuse is sometimes really very powerful, and people don't recognize it. We do know that if people have had problems with child abuse concerns or weren't getting along with their parents too well, and the Child and Protective Services got involved, they actually have a higher incidence eventually of having brain trauma. And that's very sad. And that's...
Well, I mean, a question like, what can we do about it is not a very good question.
Well, what can we do about falls? What can we do? Because that's when you get to the older population, that's a huge part of the percentage of people who have brain injury.
In the adult, I mean...
In adult world.
Especially older people.
Yeah, especially older people will fall very frequently. Other people, they get it from fights, you know, sort of their head hurts enough to have it be like it's ringing, the bells are ringing in their head. Yeah. Those kinds of things, they're getting that from all kinds of sources. And of course, car accidents are very common, particularly among the teenage population.
Now I know what's wrong with me. I've had 2 falls on my head, backwards, but had...
Were you unconscious?
No.
See, that's one of the...
But I had a CAT scan, and it was okay.
You had a CAT scan. They probably did something
But
like
now
that.
I can blame everything on those 2 falls.
That's right.
It's better than nothing.
Better than nothing.
Yeah.
But at least you're aware that there may be some trauma to your brain.
Yeah.
That is bothering you maybe sometimes. Maybe you get vomit a lot. Maybe you get, you know, if you can't sleep very well. Those kinds of things. You can't remember things all the time.
That's not age, huh?
No, not age. No, it might be.
No, that's the good news, because we blame everything on age.
Yeah.
Right?
Cool.
So what would you suggest to our vast audience about brain injuries?
Well, I would suggest that, number one, people are careful with each other.
Yes.
Too, because that can have it.
Of course.
If parents aren't getting along, they may be traumatizing each other physically.
Yeah.
You know, the other things that if the people can handle that, not just think it's, you know, well, this is part of life. The other thing I think is important is that we just don't rely on the techniques we used to use for assessing whether this is a really traumatic issue. I mean, a real, like they would say, you see this with the football games, for example. I've talked to some of the football doctors, and I saw it. I actually criticized one of a good friend of mine. I said, well, you said the guy was able to get up and play again because he answered all the questions that you ask. And there's about 5 or 6 questions that they standardly used to ask. Now it's a much more involved thing. And he let a player go back in the game who was a very bright man. I happen to know the guy, and he was the player. He let him go back into the game, And I called him the next day. I happened to see it on TV. I don't watch football as a rule, but my kids were watching it, and they said, "Oh my gosh, so-and-so, I don't want to mention any names, was hurt." And so I stayed and watched, and I saw him walking around the field on TV. And he just looked like his clock was wound, you know, it's just, oh my God. And I called the doctor the next day, and we talked about it, and he took him to see a neurologist. And the neurologist said, absolutely, no more.
No more playing.
No more playing, because that was one of many head injuries.
Yeah.
So that's the kind of thing.
So we just have to be so careful of our bodies, right?
Absolutely.
And everything.
And you know, on these gentlemen who committed suicide, who had been star players on their teams, they found significant brain damage to their brains.
And that's why they committed suicide.
That's what they
think. Yeah. What else can we do?
What else do we do? And
what else can we do to? Well, I think education is number
for
one,
sure.
Right?
But you know, this love of sports that we have, and I have no, you know, I don't have any strong feeling for one sport or another, but some of them are pretty dangerous.
Like football?
Football, and we use a lot of times head maneuvers in soccer. People are banging their heads up on soccer balls. And even in volleyball, to some degree, that can happen.
Yeah.
And then, of course, hockey and the fights that they get on.
Yeah, and boxing, can you imagine?
Boxing, too. Boxing is notorious.
You know what we should do? We should be born with helmets. You know, and it's all we do for the rest of our lives. We don't have to worry about our hair, our hats. We can just gradually get bigger and bigger helmets.
Or better and better helmets.
Or better and better. Yeah. I just thought of that. No, but I mean, we can't go around being that neurotic, right?
Right.
Yeah.
Plus, a lot of people would think it's cute to hit you on the head because you got a helmet on.
That's true. And that could hurt you too.
Oh yeah, helmets are good, but they also provide, you know, protection on the one hand, or on the other hand, you get one heck of a bang up when you get hit just right with a helmet on.
We had one of our members at the forum. He had a person with him, a therapist with him, you know, to make sure his walking was okay. But he happened after the walk, he stumbled they were waiting for a light. He stumbled on the curb and fell backwards, and he was dead.
Oh.
So, but we can't, Stan, we can't go through life being so paranoid and worried.
Exactly.
What can we do? You got. I mean, you're such a good psychiatrist. You know so much. Aside from, I mean, just tell us a secret.
Well, I don't know any secret, but I think that if I wish I knew the secret. But I think one of the things we should do is not just say, well, this person is up and walking and doing, you know, go back to the game, go back to this, go back to doing that kind of thing.
We shouldn't say that.
Well, if you just
let it
go. You shouldn't just say go.
Oh, you should. Yeah, okay.
You should not say that.
Not say that.
And I think, you know, for older people, sometimes having the walker is critical. In some ways, it can be a problem in terms of getting around and, you know, stuff like that. But like getting in and out of cars. But on other hands, it's something that people should be, if they are prone to falling or they don't seem to have the strength in their legs that they had before, or the coordination in their legs.
Of course, yeah.
They should probably use a walker or a cane much more regularly. That would be my guess, but I don't know if anybody's ever studied that per se in a scientific way, but it makes sense to me that we should be thinking in those terms.
Yeah.
And I think the walkers need to be designed differently too.
Because it hunches the people over. It hunches you over,
and sometimes it can slip out of your grasp. And I see a lot of people walking around with walkers, and they're just leaning forward, hunching, and that's actually training their body to fall forward eventually.
That's right, rather than back. And the new key word, mantra, is mindfulness.
Yeah.
How would you define that?
Well, mindfulness is just being able to put yourself in the place that you'd like to be, a calming place. Think about that. That the aim of mantra and the aim of just mild hypnosis is really the same, in my opinion. People came about it in different religions, different lifestyles, and they put themselves in a place where they are relaxed and calm, and they get their bodies in line with what they need them to be.
That's so important, and you're saying the perfect thing, because we're near the end of this wonderful show, because you're on it. Do the breathing thing for us.
Well, the breathing thing is just to basically close your eyes and slowly breathe in and out. So let's say you can use any number combination, but breathing out should take about twice as long as breathing in.
Really?
Yeah. And so if you...
Could you demo?
Sure.
Okay, do it.
So let's say we'll do it to a count of 4 in, so then I will do it to a count of 8 out.
Okay. Okay, so...
So just to basically close your eyes and you imagine a beautiful scene, a scene that's very pleasurable, the beach, some experience that you might have had in your life that you'd like to just enjoy. You close your eyes so you're not distracted, and you breathe in, let's say to a count of 4. When you fill in at that point, you then slowly breathe out to a count of 8. You know, if you do that even in bed,
yeah, you're going to go to sleep.
You'll fall asleep.
Yeah.
You do it enough times in that.
That is very important information.
Good.
And you did another one, I think, on one of the shows where you look at something, and maybe it's another show I'm thinking of.
I know it could have been. I'm trying to think of.
Yeah, think of another one.
Not sure right now. If I think of another, I'll call you up and you can put on another broadcast.
No, but I think and this goes for well, certainly not children, but maybe adolescents, to learn how to relax, to learn how to lower all of our stress. Not all of it, but if we can keep ourselves calm and mindful, I think it helps a lot. Don't you think?
I think it does too, yes.
Yeah.
It does a lot in so many ways.
Yeah.
And I think it's just a wonderful technique, and it's so easy to do.
It is.
You know, it's so easy to do, and you just have a chance to sit like we were just doing now and doing it.
It's so important. And getting back to your profession.
Yeah.
One of the things that I so admire about you, Stan, is that you're so enthusiastic, and you can tell you're so caring. And no, really, I don't mean, I'm not flattering, this is compliment, but how many children, how many people, adolescents, that you have helped over the years. How does that make you feel?
Wonderful. That's why I go to work all the time.
Yeah.
A lot of people ask, why do you go to work? You can retire. No, I don't want to retire.
Never.
Hopefully. I mean, if I can't do it anymore for any reason, I would retire.
But I think retirement is very, very negative for a lot of people. Don't you?
For some people, absolutely.
Yeah, some people love it.
Well, some people love it, but also one of the studies that's been shown over and over again is if you don't have people around you, companions, you really suffer, you get more and more lonely. And that's one of the reasons people join a place like the Forum. It's one of the reasons that people join clubs of one kind or another, particularly if the person that they had been living with for many years dies or is ill or incapable of being a partner.
Right.
And we all need partners. Pretty much all of us need partners. And if we don't allow ourselves to have partners, in terms of friends, in terms of wives, husbands, that kind of thing.
Right, right.
We're missing out a tremendous amount of our life. We become more and more reclusive as time goes on.
Right, right.
And it's hard not to. And then again, it's hard to stay in that lonely position.
It sure is, yeah.
So there's a lot of factors that go into developing a sort of a calm, an inner calm that could be very useful.
So socialization
Socialization,
is paramount.
absolutely.
It really is. And some people just want to stay in their house till they're 90, but they're by themselves. And
I think that's got to be very
so
difficult.
lonely. Yeah, loneliness is. You could be lonely in a crowd, though, too.
Yeah, of course.
But anyway, I want to thank you so much, but you have to make me a promise
I'll try.
that if we're alive, in 3 years you'll come back again.
Fine, you got a deal. You got a
You
deal.
always have such wonderful information. I really, really just love having you as a guest. Thank you so much.
You're very welcome.
And I want to thank our crew. I'm really crazy about our crew. We really
should be.
stick together. We have fun. You know, we may not agree on politics and stuff, but
Who does?
we can't. Who does? And of course, I want to thank our viewers for watching. What would we do without you? And I think this station, KMVT, is really a
lovely.
fantastic gift that we have. So here's one of my favorite parts, because I'm a frustrated actress, okay? But at the very end of the show, it's my show, right?
Yeah.
Here's what I love to say. I can't wait to see you next time. Bye-bye.